Hello, everyone, and welcome to this audio podcast as part of the Bostix Titus issue, Titus issue, and an audio podcast as part of the Analytical Storm, and an audio podcast as part of the Science Storm, an audio podcast as part of another Storm Bostix production. In this audio podcast, there'll be a a sort of a link aligned to the initial audio podcast, where the initial podcast in this series looked at an intro, and this audio podcast will look at in context of questioning why is healthcare education important. So. Uh, I like to again the example in around chronic kidney disease, or where chronic kidney disease is concerned, a func in around the anatomy, renal pathophysiology, renal pathophysiology. The functions are generally multiple. And so, to name a few, they are involved in they're involved in around in around endocrine homeostasis, in around arterial blood pressure, sort of physiology in context of the renin angiotensin aldosterone system, acid-base balance, calcium and phosphate metabolism, excretion of waste produce, and also, for example, plasma volume control as well. So CKD complications stem or can stem from a variety of physiological, immunological, pathological, hematological, and biochemical complexities. Ultimately becoming multisystemic, and owing to the nature of the disease, of the condition or the disease, CKD patients may also encounter varying healthcare services, such as laboratory investigations, and CKD patients are also can be prescribed medications throughout the disease, or the trajectory of the condition, and and where and where and where and where the and where in around the condition, this exists, this exists in context of pre and also post transplanted, and pre and post transplanted recipients. So more and more patients are being prompted to more and more patients are being encouraged and prompted by health professionals, as well as those as peers to ensure that they are kept ahead in context in context of um, in context of healthcare and service healthcare service provision. So whilst there has been has been research carried, little has or is otherwise known about what topics, for example, what topics and subjects patients discuss and share through, for example, peer support groups, and across social media platforms. Except that some patients will endeavour to seek out further understanding surrounding relevance in around blood tests and investigations, and also in line to parameters and reference ranges according to condition, especially in context and line to electronic patient records. And what this means, listeners, is that listeners and viewers, is that patients and recipients, where patients and recipients have access to electronic patient records to sort of gain understanding around laboratory tests and investigations. At the same time, historically, where patients access information in line to their electronic patient records, historically the context in electronic patient records historically has been by default in a by default sort of numerical versus for example lay language and around and in context of healthcare. And so certainly access to electronic patient records does not guarantee that patients know how to use the information. And where there is little understanding, or can be little understanding, where there can be little understanding how effective online consultations are as well. So patients want more understanding of health in a range of areas, and require healthcare professionals to be part of discussions, and where they can get health disciplines, and where they can get more sort of a basis around healthcare accordingly. And so by encouraging education and regarding context across a range of healthcare disciplines, this would and should reduce inequity, increase literacy and language, and improve overall healthcare in context of public health, but also in context of population medicine as well. So thank you for tuning in on this audio podcast as part of this Bostix Titus issue, as part of this audio podcast, was part of an analytical storm, as part of the Giant Storm and another Storm Bostix production. Thank you.